Hello, you're tuned to Pregnancy, Birth and Beyond, contemporary conversations where stories, science, traditions and new ideas meet. Pregnancy, Birth and Beyond. It's about family, connected parenting, celebrating your amazing body, connection with your community and finding your truth. Our show is coming to you from the studios of BayFM in Byron Bay and is broadcasting across Australia on the Community Radio Network and globally via our podcast at pbbmedia.org.
Hello, welcome Dr. Melanie Jackson. Thanks for being on the Pregnancy, Birth and Beyond show today, for taking the time out of your day and coming to discuss home birth with us. We're very excited.
Thanks for having me.
Awesome. Well, we might just jump straight in. Would you like to tell us a bit about your background and how you got into home birth and midwifery and a little bit about your background?
Yeah, so I got very interested in working with women and children in my work as a naturopath early on, and that very quickly thrust me into studying midwifery. And then pretty soon after studying midwifery, I discovered home birth in the process and was very determined to pursue home birth as a career when I was a midwife. And so I did my training in a hospital, but at the same time was being mentored by another home birth midwife who showed me everything about home birth that I needed to get started and care for women at home. So very early on, I was passionate about home birth, and that's just never left me. And so I've never worked in a hospital outside of my training. So all of my experience is in home birth.
That is so amazing. What a privilege to have that as your background and as the setting in which you have come to learn about women and maternity.
Yeah, it's really interesting because I very much see birth in such a different way that I think people would see it in a hospital. And so I know it in a unique way, I feel. Yeah, and that led me into my PhD topic, which was birth outside the system. Mm-hmm. And so soon after starting as a home birth midwife, I started my PhD into birth outside the system. So it's all really been interconnected through my whole career.
So what is birth outside the system? What did you do your PhD on?
Yeah, so my PhD was called Birthing Outside the System, and it's about women wanting the best and safest for their births. And the research was focused on talking to women who made choices that were completely outside of what we would consider an acceptable sort of decision for birth in society. So these were women who chose to free birth, and a free birth is a birth that is intentionally unattended by a healthcare provider, and often women will do this at home. And I also spoke to women who were choosing to give birth at home when they had known possible complicating factors in their pregnancy, where either themselves or their baby had a risk factor that would generally have excluded them from a home birth if they were to go through a home birth program. So these were women who made a conscious choice to give birth at home completely outside of an acceptable social construct around birth. We didn't look at women having home births who were low risk, which is often the research focuses on low risk women having home births because we know a lot about the positive outcomes that they experience. We don't know a lot about the decision-making process that women make when they go completely outside the system. And this was quite unique in Australia. So there was a little bit of research on this in America, but in Australia, we really knew nothing about these women in an academic sense. So I think in the community, women know about these things, but in the academic sense, it wasn't very sort of well known. So we basically asked that group of women what motivated their choices to give birth outside the system. And I feel like in the end, it wasn't really a big surprise what we found. And ultimately, women make choices that what they consider the best and safest for themselves and their babies. And so women who birth in hospital are motivated by keeping themselves and their baby safe. And in the same way, women who birth outside the system are motivated by what keeps them and their baby safe. But what was unique as well is that these women very much held their psychological and social well-being very high. And so a lot of them had experiences in a hospital where their emotional, psychological and social needs weren't properly met. And so they pursued birth outside the system as a way of having all of their health and well-being needs met. And so what they found was that they felt they couldn't achieve that level of safety in a hospital and needed to pursue another way. A lot of them actually came to make these choices because there wasn't access to a home birth midwife. So, for example, most of the free birth women actually had a preference to give birth with a midwife, but for various reasons, either through lack of access or unable to afford a midwife, or there just isn't one close by, or the midwife who was close by they sort of didn't really connect with. They started to go down the line of, what would I do next? You know, I have no intention of birthing in a hospital. I can't really access a home birth midwife, which would be my first preference. And so instead of going back to the hospital after that, they actually deferred free birth. So for most of the women in the study, free birth wasn't their first choice, but they went there because they were forced to, because their other options were unacceptable to them. And that was a similar thing with the high-risk home birth women. They did find a midwife to care for them, but they felt like their outcomes would be better at home and they would be safer physically, emotionally, socially, and in all other ways by giving birth at home. So, you know, it's not surprising that women are motivated by what they believe is best and safest when they're making birth choices. And the other interesting thing was that when we looked at the demographics of the women who participated in this study, the rates of women who have studied higher degrees were 3 times higher in this population than the general population. So about 75% of the women in the study had a bachelor degree or higher. And so they actually were quite well educated. And when we spoke more and more to them, it was quite obvious that it wasn't them making these risky rogue choices that was the focal point. What became obvious is that the failure of the current Australian medical system is pushing these women to make choices that they feel like they have to make in order to be safe. And so they viewed the hospital system as the least safe option when they compared it to the option of giving birth outside the system. And that was because they had experienced the hospital system as unsafe in the past. They did not want the level of intervention that was offered there in a routine manner. They were happy to have interventions, but not interventions that were just routinely offered. They also found that the level of care that would be given to their wider family wasn't there in hospitals. So many of them couldn't have their children there, and their husbands felt disempowered by being in a hospital situation. So they actually wanted the best for their whole family. And so giving birth outside the system offered that. And and a lot of them came from birth trauma in the past, where they potentially had post-traumatic stress and actually couldn't re-enter a hospital for those reasons. And these birth options for that were viewed as much safer than the emotional treatment that they'd experienced in a hospital in the past.
Amazing. That's such a comprehensive overview of what can often happen and is misunderstood often when we're asking, why do women make choices outside of the norm, or in general, to say that what's motivating people to make decisions outside of the norm. It's really great to have a clearer understanding of what is prompting those thoughts and those decision-making processes. And I mean, we hear so much about birth trauma, especially lately in the news. There's a lot coming through, and I hear it daily from women whom I interview and speak with about their maternity care. And it's such a driving factor often in how women come to maternity care when they do, especially if it's a second time round, or if they've had some form of trauma previously that had to do with their bodies before even they've given birth. Okay, and we're back with Dr. Melanie Jackson and discussing home birth. Specifically, we'd love to hear from you about the scope of home birth. So what happens at a home birth and who attends a home birth, and generally what women expect from their home births?
Yeah. So I guess a home birth would be defined in a way of having your baby born at home under the care of a registered midwife. So what usually happens when women plan a home birth is that they would actively pursue a particular midwife to be their main carer. And so often it's, an internet search and then scoping out who's in the area. And then the women can come to their midwife and have their antenatal care, their birth care, and also postnatal care, usually up to 6 weeks, done with the same care provider. And so this is called continuity of care. And when we look at all the research on continuity of care and specifically continuity of care with a midwife, the outcomes for women and babies are comparable to other models of care, except women always experience a much higher level of satisfaction and what they describe as greater well-being, having been under the care of a midwife and having continuity. So I think that, so even broader than actually choosing a home birth is when you choose a private midwife, you can actually choose multiple locations depending on where you want to give birth and actually still benefit from having continuity of care with a midwife. I think it's a beautiful element to be able to give birth at home with your midwife, because the power is taken away from the institution and the care provider, and it remains with the woman in her territory and her space. And so she's the driver of her care, and the midwife is there as the advisor about, okay, yes, this is fine and normal, and the women can use the midwife as a resource. And we do all the same physical checks that a hospital would offer. And as part of care, we collaborate with other care providers depending on the woman's need. So their GP might be involved, or if they have a few complications, we can involve their local hospital. And so actually the woman can choose who she will engage with at various times, and if things arise that she needs extra care for. So I think home birth is not just about having your midwife and giving birth to your baby at home. It's about the woman having control over the whole process of her antenatal care, birth, and postnatal care. And so even if she needs extra care that's outside of what her midwife can offer, the midwife is capable of sort of working with other healthcare providers to make sure the woman has the individual and specific care that she needs for her circumstance. And so home birth means that you give birth at home, but more importantly, that the woman keeps control of her care providers and who is there and what may or may not happen.
Wow, that's wonderful. And it provides the mother with the care that she needs throughout. And so what are the benefits of continuity of care? You mentioned that we know from the research that it's wonderfully beneficial for receiving continuity of care. But in terms of physiological benefits and health benefits, what are the benefits of continuity of care? So, and just to clarify, maybe you could speak a little bit to continuity of care. What exactly does that mean?
Yeah, so continuity of care means that you would have your own care provider with you for your full pregnancy, birth, and postnatal care. And what actually happens then is there's a relationship that's built between the woman and her care provider and her midwife. And the midwife gets a really deep understanding of the woman's philosophies and her priorities and what she wants for her birth. And so there's no sort of negotiating at the time of birth as to what the woman is going to want or not want and what her preferences are. There's a deep understanding of that before we even get to the birth. And so that trust relationship actually makes birth safer, because if the woman then does need some care, extra care that might be out of the scope of the midwife, then the communication between the midwife and the woman is sort of conducted in a way that the woman can receive and hear information and trust that the midwife is being honest and respectful of her wishes. And then the woman is not sort of necessarily suspicious that the midwife's got her own agenda or that her care provider has a particular agenda to make the birth go in a particular way. So the midwife is focused on the woman having her preferences and desires met, but also there to help give advice, and maybe if the plan needs to change, they can talk about that together. So not only does continuity of care rely on a trusting relationship, it allows the woman and the midwife to create a safe environment rather than having a stranger there who the woman doesn't know, may not trust, or even believe the information they're giving it at a time that, you know, the birth plan might need to change. What they've also found is even if women receive continuity of care in a hospital, that the outcomes are better than standard care, which is, you know, you just see any care provider, you don't know who it's going to be. And they've also done research that actually women who are higher risk in continuity of care models have the same outcomes as if they just had care with obstetricians, and it's actually cheaper to deliver it with the same outcomes. So that was the Mango trial. So that's really comforting for hospitals to know that actually they could give continuity of care to women of all levels of risk and actually have the same great outcomes for less money. So I think that what it also highlights is that midwives are the best care providers for women in maternity care, and that every woman should have a midwife, and that sometimes need to include other care providers for the women's specific needs. But continuity of care with a midwife just really highlights that the relationship between a woman and a midwife is the safest option for birth.
Amazing. And just to clarify on that point, in Australia, currently the way the maternity care system is set up, and that is changing within the next coming months because there's a new maternity strategic approach to maternity care here in Australia that's being rolled out coming 2020. And we'll see how that spans out. But there's some great progress in terms of providing continuity of care. But at the moment, and it has been like this for many, many years here in Australia, women do not have continuity of care. The majority of women in Australia do not have continuity of care for their maternity care. I think it's less than 10%. For example, to compare, in New Zealand, more than 80% of women have continuity of care for their maternity care. It's around 86% of women have continuity of care with a midwife for the duration of their care, regardless of if they need to see another care provider. And that means that midwives with them, I'll reiterate what you've said, for the duration of the pregnancy, the labor and the birth itself. That's a really important critical aspect of continuity of care. And postnatally for the first 6 weeks at least, with that same care provider who will able to pick up any issues that happen postnatally, which, as we know, can be numerous, from breastfeeding to tearing to all sorts of different things that can and do occur postnatally. Postnatal depression. It's much easier to pick up if you've known the woman before than if you've never met her before and don't know what she's like. And suddenly she's maybe a little bit disinterested or depressed. You can much more easily pick that up if you've known her for the duration of her pregnancy and during the childbirth as well. You've got that background information. It's not just something you're reading from a piece of paper about that woman. So I think there's so many benefits that are probably not mentioned even in the research itself, continuity of care provides to women. And it's wonderful to see that you're working within that model of care, and that hopefully that's going to be more available to women here in Australia.
You're listening to Pregnancy, Birth and Beyond, contemporary conversations where stories, science, traditions and new ideas meet. For more information about this show, head to pbbmedia.org.
So we're back with Dr. Melanie Jackson on the Pregnancy, Birth and Beyond show, and we've been discussing home birth in general and also choices that women make around their maternity care and what's important to them within maternity care. And recently we've had some great research come through, and Dr. Melanie Jackson is going to walk us through this research. What is it called? What were the major findings, and what does it teach us?
Yeah, so there was a study which we have a lot of international research which says that home birth is just as safe, if not safer, for low-risk women who are under the care of midwives and who are well connected with a healthcare system. So we have that information. What we don't have is information about if that could translate into the Australian context, because our context is fairly different to other international contexts in that internationally, the option of home birth and midwifery care is a lot more accepted and actually integrated into their systems. Often the countries that have them actually don't have these necessarily vast distances that we operate under in Australia. And so we sort of were hoping that in Australia, home birth was just as safe as internationally. And what this new paper indicates is that, yes, it is. So the paper title is Maternal and Perinatal Outcomes by Planned Place of Birth in Australia. And they did a study. They included a large number of women. There was over 1 million women births in this study. And what they found is that the death rates of babies and all these things didn't really change across hospital, birth centre and home birth, but that women planning a home birth were actually able to have the same outcomes as a hospital with significantly less intervention and a much, much higher normal vaginal birth rate. So what the study highlights is that home birth for low-risk women is safe in Australia, even though we might not necessarily have the detailed and intricate systems that other countries have. So we're managing still to keep it safe, which is amazing. What it also highlights, though, is that your baby is also physically safe giving birth in a hospital. However, the women will experience a lot more intervention doing it that way. So it seems as though this study is not only highlighting that home birth is safe and that hospital will give you a similar outcome to a home birth in terms of your baby safety, but that women do so much better having given birth at home. And we've so long forgotten the importance of caring for the mother as well as the baby, because if the mother is well and healthy and able to be positively transformed by her birth, that's actually going to turn into a positive breastfeeding and mothering journey. So really, we should be prioritising birth options that have the best outcomes for the mother without compromising the outcomes of the baby. And so I think what this study has shown is that that is completely possible. Even just by planning a home birth, you've got a 95% chance of giving birth vaginally with no intervention and still having the same outcomes as a hospital, where your chances of a normal vaginal birth with no intervention are significantly less. So I think this study not only highlights the safety of home birth, but the amazing benefit to the woman without compromising the well-being of the baby.
Wow, that sounds incredible. And it's so great to see that this study, because we've had research around home birth for many, many years, international research stating that it is very similar results to this research paper. But the significance, as you mentioned previously, that it is an Australian study conducted by Australian researchers looking into the impact of women's choices and access to maternity care right here in Australia. And it's recent and it covers so many different births. As you mentioned, over 1 million births were included. If I'm not mistaken, it was 1.25 million.
That's right, yeah.
Such a significant number and such a great way to look at the data, because we do need to see across a larger scope of data to have that understanding that, yes, it's not just a random result. It's quite significant across the scope of the population. I wonder if you could maybe just touch slightly on the context. We don't have a lot of time, but touch on the context of home birth within the wider picture of the provision of maternity care, and why is it so important, apart from the obvious benefits and the amazing results we've just heard about, which are of course so relevant, but some women won't be able to access home birth. And why is home birth relevant to their choice making and to the overall provision of maternity care here in Australia?
The current rhetoric around providing maternity care to women is that it should be woman-centred. The only problem is that the current system is system-centred and institution-centred. So we're offering women only what suits the institution rather than what they actually want. So if women are offered the full menu of options and they get to choose, and then they can pick their care provider, pick their location, then that is true woman-centered care. That is the woman making the choices, rather than an institution or a hospital or a care provider offering a limited amount of services and saying to women, well, these are your options. If we focus on care that is woman-centered and that focuses on well-being of the mother and of the baby, then we can't leave home birth out, because there's so much research that indicates that women who have home births do very, very well to their babies, and also that women who have access to midwives do exceptionally well as well when compared to the standard care that's offered in hospital. So we can't continue to ignore this massive body of research which keeps pointing to women having midwives as their carers, and then women being able to choose which location they're going to give birth.
So we're with Dr. Melanie Jackson, and we've been discussing home birth and making choices outside of the normal provision of maternity care, and how that impacts a woman and her family, and how that impacts the system. We've heard about the latest research on home birth, which sounds fascinating. And we're going to say goodbye soon to Dr. Melanie Jackson. But before we do that, we'd love to hear a little bit more about your projects and what's happening at the moment. I've heard that there's a book in the works, and that there's a wonderful YouTube channel which mothers and families and also care providers can go to learn a little bit more about topics that might be tricky or of interest to them. Can you tell us a bit about that before you head off?
Yeah. Well, firstly, the exciting part is that I was one of the contributors to a new book that's coming out called Birthing Outside the System, Canary in the Coal Mine. And basically that really puts a spotlight on the current difficulties that women are experiencing within the system, and ways that we can overcome that and actually make birth so much better for women and babies. And so that's coming out soon, and it's going to be amazing because there's a lot of contributors to that book. The other thing that's happening is that my YouTube channel, academic research out into the public in an accessible way that women can use, and midwives and birth workers can use it as a resource to actually tap into current research.
We hope you've enjoyed this episode of Pregnancy, Birth and Beyond. Tune in next week for more information and inspiration, bringing us full circle. You can find our show on iTunes, Spreaker, the usual social media under Pregnancy, Birth and Beyond, and our website at pbbmedia.org.